Hi, everyone. I'm Thomas Shaffer. I'm the president of an organization called Healthy Campus. We provide a platform for documentation and reimbursement of mental health services at public schools.
My name is Jin Lee. I'm the founder of LVIS. And at LVIS, we use artificial intelligence to understand human intelligence so that we can cure brain disorders.
I'm Frank LaFerla. I'm a distinguished professor of neurobiology and behavior and the dean of the Dunlop School of Biological Sciences at UC Irvine.
I'm Gorkey Vemulapalli. I'm the chief technology officer for a company called Oral Genome. We detect disease before it happens so that you can prevent it before instead of finding a cure.
I was close on your last name, Gorkey, but didn't nail it. So AI is infiltrating healthcare at every level in my world. I'm sure it is in all of your worlds as well. So in just a few minutes, give us your biggest impact on how AI is either helping your business or hurting it very badly.
Within education, we don't have people like those that are in this room that are kind of chomping at the bit to adopt technology. However, AI within the documentation of mental health services is making a huge impact. As was discussed, as you mentioned, Jay, in your practice of using AI as a scribe to document, we can reduce clinician burnout and improve patient outcomes significantly by using AI ambient dictation to sit in on conversations that are happening between clinicians and students or patients, to document the encounter and to improve patient outcomes. And so, yeah, it is making an impact even in education within those settings. Jin.
So we actively use AI to understand brain function. We're not just automating things where humans could do it before. The brain was traditionally a place where we can't really see anything on what's going on. And therefore, diagnosis was impossible, treatment impossible. So everything is not solvable right now. But using AI, we use the technology to understand how the brain works. And now that we have a very good understanding, which also sits in a automated platform, we can very rapidly figure out how the brain is working. And so if you're having some memory symptoms where you can't remember things, you're having an anxiety attack, or you're having autism symptoms that you don't understand, these are things we can directly visualize during the course of the behavior now. And so being able to understand what's going on and treating it now becomes a rather trivial task. And so it's really revolutionizing the field that I'm in.
Frank? Yeah, I think it's still in its infancy, at least in life science research. I think there's been a lot of impact in terms of data analysis, looking at big data, integrating multimodal data. It certainly has helped in imaging, and like MRI, like you were saying about radiology, but also in cellular imaging. The challenge we have in the life sciences is that there's so much inherent variability in biological systems that I don't think we're quite there yet with that, but I think we'll get there.
Gorkey?
Yeah, so the work that we do at Oral Genome is prevention, right? Not a cure. So how do you prevent it? First, we have to know where it is starting before the disease starts. So we go to the biological origin of the disease from a cellular level, and we need a lot of AI to model those, different scenarios to predict where it's going to end up, right? So we use AI, not the Gen AI, but the traditional old school ML, AI and ML stuff, which is repeatable. So the challenge that we have with the Gen AI is, as Frank rightly mentioned, in life sciences, there's a challenge in healthcare and life sciences where if we cannot repeat the result with the same set of data, then it's not useful. So that's a challenge. So that's why we still use the old traditional AI, and we're getting there.
That makes a lot of sense. We were talking about, Frank and I were talking about how a lot of the drug discovery is being done by AI, yet a lot of the drugs aren't actually working out very well for human use. And I kind of likened it to, the recipe for a brioche. If you give somebody a recipe for a brioche, you're going to get a lot of different brioches. But if you give it to the machine, you're going to get the same one every time, and it's not going to be good. So with AI, it's definitely an issue with the human factor in a lot of the fields that we're in. Especially, I look at AI in surgery and wonder how AI is going to be able to shape a nose or really understand the artistry of things like that, which even comes into play in things like liver transplantation. So in terms of that, has there been something where a human didn't do it, where AI impacted your field, and you said, "Wow, that's amazing that came out of the machine, and we're using it now, and no human had a role in that"? And Jin, you look like you got an answer for that one.
Well, you bring a really interesting and important point. Having insight, gaining